Thanks for joining us today. This is going to be the first webinar of our 2017 QCDR webinar series. This webinar is going to be presented by Judy Burleson, Senior Director of the Quality Management Programs here at ACR, and Alicia Blakey, Administrator for the Quality Management Programs. So I'll turn it over to Judy.
Good afternoon, everybody, and thanks for joining us. Looks like we have a good group on the line. We have a number of previous users of the QCDR, and we're glad to have you back and welcome those that are new to the process. So Alicia and I are going to attempt to do a short presentation to allow you a good bit of time to ask questions, because that can be more useful at this point in the game. And I'm going to do a short overview or review of the MIPS requirements in the Quality Payment Program, but not go into a lot of detail with that so that we can spend more time with the QCDR. We'll look at the MIPS performance categories and the requirements for those, some of the benefits of using ACR registries for MIPS and of using QCDRs, and more importantly, or very importantly, the timeline and key considerations. We'd first like to do a poll to get a sense of what mechanism the people have used in the previous year, in 2016. So we're going to ask you to enter one of these categories. Give it just a couple more seconds. Okay, so it looks like the largest percentage used claims, followed about 38%, followed closely by qualified registry at 29%, QCDR at 23%, EHR 2%, and several people aren't quite sure. That's a good indication. So a quick overview of MACRA and the Quality Payment Program. As many of you are probably aware, the MACRA is the Medicare Access and CHIP Reauthorization Act that was enacted in 2015 and authorized CMS to implement the Quality Payment Program starting January 1, 2017. The Quality Payment Program has two basic pathways: the Merit-Based Incentive Payment System, now lovingly called MIPS, or Advanced Alternative Payment Models. And participation in either of those pathways will result in either a positive or negative adjustment on Medicare reimbursements. The MACRA legislation has sunset the three legacy quality programs that CMS has had over the past few years: the Physician Quality Reporting System, the Value-Based Payment Modifier, and the Medicare EHR Incentive Program. And these are streamlined into MIPS with an additional category: improvement activities. So the MIPS performance categories: quality, improvement activities, advancing care information, and cost. Each of these have a specific weight to them, which is used to calculate a total performance score, final performance score, to determine the level of adjustment for individual clinicians or groups. In 2017, for the transition pick your pace year of MIPS, the cost category will be 0. Quality will be 60%, advancing care information 25%, and improvement activities 15%. You can find additional resources on MACRA on the ACR web pages as shown at the link on your screen. And a quick view of items to consider and think about for participating in the quality payment programs. First of all, understanding the requirements and your eligibility as a Medicare provider, looking at the clinician type or whether or not you are newly enrolled, looking at what your patient-facing status is dependent on the level and volume of face-to-face encounters determined by a list of specific encounter codes that CMS has published. Thinking about the volume of Medicare claims that you submit and your status as a rural facility or rural provider at a federal qualified health center or rural health center. Looking at whether you are a hospital-based MIPS clinician, and that's dependent on the level of services provided at a hospital based on certain place of service codes. You would think about whether you want to report as an individual or as a group under the group practice reporting option. And in 2017, there's no need to register as a G-Pro with CMS. You can determine that at the end of the reporting year. You would think about which submission method you want to use, whether it's claims, qualified registry, or a qualified clinical data registry, or EHR. Review how ready your practice is to participate in MIPS. If you participated in PQRS in previous years, then that's a good place to start. Keep doing that. But in 2017, it is a pick your pace year, so there is a range of requirements that you would meet in order to avoid penalty or potentially obtain a bonus. Review the 2017 measures, and both in the quality category, advancing care information, and improvement activities, and get a good sense of what you can report. But most importantly, take care of your patients, record the information, and submit your data. And looking at the 4 categories in MIPS and the submission options that are available for both individuals or groups, for quality category, there are many mechanisms that can be used. For individuals, claims is still an option, or using QCDR, qualified registry, EHR, and administrative claims. Actually, that shouldn't be there. Administrative claims is allowed for group reporting, and that is for the hospital readmission measure. Also, for group reporting, groups of 25 or more can use the CMS web interface and use the CAP survey for MIPS, using a survey vendor for that. For the cost categories, there is no need to submit data. That is done through CMS calculations using administrative claims. For the advancing care information and improvement activities categories, individuals can submit attestation either through a QCDR or a qualified registry or EHR vendor, and CMS is to make available a portal to do that attestation as well. Groups can also use those mechanisms as well as the CMS web interface. Improvement activities can also be submitted using a QCDR, qualified registry, HR vendor, and through a CMS portal. Again, the CMS web interface is also an available mechanism for groups. So basically, what is a QCDR? It's a Qualified Clinical Data Registry, a mechanism that was authorized, that CMS was authorized to use beginning in 2014 for participation previously in PQRS, but now in MIPS. This is distinct and separate from a qualified registry where qualified registry can submit data for the MIPS, or formerly the PQS measures. They can submit those types of measures to CMS. A QCDR, which is an approved entity by CMS, can submit measures specific to the registry. So those are considered non-MIPS measures. And just to note that when using a QCDR, you must submit data for patients across all payers, not just Medicare beneficiaries. And actually, this is a requirement for qualified registries in 2017 as well. QCDRs can submit quality measure, improvement activity, and advancing care information measure data to CMS for its participants. Some benefits of using a QCDR, whether it's ACR's QCDR or another QCDR, is that they can support both individual physician and group practice reporting requirements. The QCDR can manage submission of the 3 MIPS categories that I mentioned: the quality category, the advancing care information, and improvement activities. With ACR's QCDR, non-MIPS measures are developed by ACR members, radiologists, and may be more meaningful and applicable to the care that radiologists provide. The ACR QCDR provides direct assistance for compiling the data needed for quality improvement. That's available through the National Radiology Data Registry, regardless of whether or not you're using it as a QCDR. And the QCDR provides feedback to registry participants on an ongoing basis throughout the year, providing the opportunity to see performance and improve as necessary throughout the year. The ACR QCDR also allows your physicians and the group to review the performance data and select measures before submitting to CMS. So to give you a better sense of what our QCDR is, it's based on the National Radiology Data Registry. And the NEAR is an umbrella of distinct registries such as the National Mammography Database, the Dose Index Registry, Lung Cancer Screening Registry, General Radiology Improvement Database, CT Colonography Registry, and our newest, the Interventional Radiology Registry. And we also collect data, accept data submissions for MIPS measures. So for the QCDR reporting, we take a selection of measures from across all the databases and submit those to CMS for approval as non-MIPS measures to be included in measures that you can submit to CMS through our QCDR. So the QCDR kind of sits on top of or beside NEAR. You need to participate in NEAR, the National Radiology Data Registry, in order to use those measures. If you think that you can meet requirements and you only want to use the MIPS measures, the former PQS measures, it might make more sense to look at a qualified registry versus the QCDR. So thinking about some of the requirements for MIPS when using a QCDR, you can use the QCDR to participate in MIPS and potentially avoid the negative 4% penalty in the 2019 payment year, and that will increase over the coming years. ACR will submit physician and group practice quality measure data, improvement activity information, and advancing care information measured data to CMS on behalf of its participants. The submission deadline to us is January 31st, 2018. And again, just to mention that GPROs are not required to register with CMS this year. but you would need to let us know prior to submission of data to CMS for your group or your individual. Now I will turn it over to Alicia.
Hello, everyone. Judy, thank you so much for that overview of the MIPS program and all 4 of the new performance categories. I think that sets good groundwork for how we transition. The whole point of today's webinar is an overview of using the QCDR for MIPS participation. From the initial poll, we know some people were still logging in and getting settled, but a majority of the audience today is reporting via claims or qualified registry. So this process may be new to a lot of users on this call. So today we are going to highlight, how to use the NRDR. As Judy mentioned, the NRDR registries, we have 6 different databases that you can sign up for, and each of those has measures that you can use for MIPS reporting, as well as for your own quality improvement and tracking patient care. So the first step if you're deciding to use the QCDR is to consider your measures and activities that you will report in order to meet the MIPS requirements. And then most importantly, from the participation checklist, you also need to decide if you're going to report as an individual physician, or are you going to do group via a group, so group practice reporting option is available if you do QCDR, and it is slightly different. It affects your patient-facing designation, how many measures. If you are a group, I'll just make sure I clarify this. If you are group reporting, CMS will collect all of your performance data across all 4 categories and give you 1 score for your entire group, and then CMS will give you also 1 payment adjustment, whether that be negative or positive. So just keep that in mind. Secondly, if the second step is if you are considering using a QCDR, but you're not already signed up for any of our national radiology data registries, there is a link provided in your material so that you can get started with that process. Part of the start is making sure that you have a registry account, and with that account, you have the ability to add information on what registries you would like to participate in, what physicians should be accounted for if you are doing MIPS reporting, and then your tax ID information is required also, so that we may analyze your physicians by their NPI and their tax ID to make sure that requirements are met. On this spreadsheet, I skipped over it. On this slide, I skipped over it by an accident, but we do have a resource because we have so many quality measures that are available. And the MIPS program is new this year. We've built a web-based tool for you all to navigate what the 4 MIPS performance categories are, what quality measures are available to you for selection. And we're actually continuing to enhance this resource. We're building in functionality so we can capture your improvement activities and your advancing care information. These requirements were not in place for 2016 PCURA, so we are making adjustments as necessary. And then lastly, if anyone has any questions about what databases you want to sign up for, you do not need to sign up for all 6 of the database registries. Just pick the one that's most applicable to your practice, and most importantly is in alignment with the services that your radiologist provides. If you're doing mammography, if you're doing CT exams, go ahead and pick those measures and let that be your focal point for the year. As another reminder, we are accepting data for all of your MIPS performance categories until January 31st of 2018. And to learn more, today is a high-level overview presentation. If you have any questions or need resources about registration or what are the fees, we have educational material on our website at www.acr.org/QCDR. That is our webpage that has all of our information. I think it's important that we now transition to each. Judy touched on all 4 of the performance categories, and I think it's important that we transition and let you know if you do decide to use the QCDR, what quality measures are available to you, what resources can help you navigate this process. I would just mention that QCDR participants are allowed to report a combination of MIPS and non-MIPS measures, as Judy mentioned prior. Non-MIPS measures are chosen from across our NRDR registries. So if you are participating in, let's say, for example, the dose index registry, there will be quality measures that could be reported to CMS to help you be in compliance with MIPS. In general, the requirement under the MIPS quality performance category is that you report at least 6 quality measures. Of those 6 quality measures, one of them must be an outcome measure. Not to worry, if you do not have an outcome measure, you can report a high priority measure instead. From the QCDR, because we have the ability to collect MIPS and non-MIPS measures to be reported to CMS, we will have over 70 measures that a practice can select from. Hence the reason why we built the measure calculator, so that you can filter those measures by your specialty, by your modality area, whether or not the measure is an outcome or not. So we've built that, we're building those resources for you. The 2017 MIPS measures, and anything that you see blue and underlined is a hyperlink, so that when the presentation is wrapped up, we'll send out the slides to all attendees, and you'll be able to navigate those resources. But we do have, the MIPS measures are posted. We will actually offer 52 measures, and of those 52 measures, we've actually broken them down by specialty areas. So if you are a diagnostic radiologist, we give you all the measures that are attributable or applicable to you. So I do encourage everyone to visit the QCDR website and download that measures list. One important note about the 2017 non-MIPS measures, these measures are pending CMS approval, so we anticipate releasing this list within a few weeks. CMS must approve all measures for all registry vendors, and so we are awaiting their feedback. Once we have that measures list, it will be very similar to the 2016 non-PQRS measures list. If for those 23% of you who participated in the QCDR last year. So we'll go ahead and move on. I think I spent enough time on quality measures, but just be aware that the QCDR will support anywhere from 60 to 70 quality measures. Transitioning to improvement activities, this is a new performance category under MIPS. It assesses how much a physician or group practice engages in activities that improve clinical care. So most of you have should have maybe joined another MIPS presentation, and so we hope that you are familiar with this new performance category. There are requirements for radiologists, but the requirements do differ if you are determined to be a patient-facing or a non-patient-facing clinician. We do have a nice piece that summarizes the distinction between those two patient-facing categories and what it means for you for MIPS participation. But in essence, in summary, for most of the improvement activities, CMS is looking for physicians and groups to select anywhere from 2 to 4 improvement activities. And what you would do is, CMS doesn't have the bandwidth to collect your improvement activities, but they want you to be able to attest, meaning say yes or no that you have completed in a particular improvement activity for at least 90 days. There is a full list of improvement activities posted on our website, and we've included it here for your resources. There's somewhere between 90+ activities, and they are categorized by communication and care coordination, et cetera. So you can go ahead and look through that list. Remember, your target is 2 to 4 improvement activities. If you are a patient-facing clinician activity, you will be required to report 4 improvement activities. And if you are a non-patient-facing clinician, which most of our radiologists probably will fall, or if you have fewer than 15 participants in your group, you would only have to do 2 improvement activities. So remember, it's an attestation, so we're not looking for actual results of those improvement activities, but the QCDR will have functionality to give you, to collect your activities, for you to tell us yes or no, and did you complete it for 90 days. So we will have that functionality. On this slide is resources. We've taken it a step further. There's a list of 90+ activities, but we have identified activities that are specific to radiologists. There are, in fact, a good 10 or 15 activities available for you because you're a radiologist or a radiology group. And we ask you to look through those. Just participating in the QCDR process will get you some credit for those improvement activities. Our last category, because remember, so right now I covered the quality, the improvement activities. Now we're going to cover advancing care information. There are 4 performance categories, but for 2017, cost does not affect any clinician, just for 2017. So for the advancing care information, we will also build functionality in our QCDR so that you may participate in this category. Remember, today's lesson is focused on 2017 reporting, but MIPS is here to stay, and we know that these rules may change for future years, 2018 and beyond. So advancing care information is meant to replace the Meaningful Use program. It evaluates MIPS clinicians' use of certified EHR technology. Most radiologists will be determined either non-patient facing and or hospital-based clinicians, so they actually will be exempt from this ACI category. So it's very important to know your patient-facing status. I believe CMS is planning on sending out letters to all of the providers in the U.S. So if you have not received that letter, it should be coming soon, but there are resources to help you identify if you're patient-facing or not. And so if you are non-patient facing or a hospital-based clinician, you are exempt from this category, which means there will be nothing that you are required to do. But there are instances, because we do support group reporters, and most of our radiologists do read for multiple imaging facilities, and they have multiple tax ID numbers that are associated with their NPI, there could be an instance where you may have to do advancing care information. If that is an option like 2016 under Meaningful Use, there is an opportunity for you to apply for an exemption. I'm not going to list all of them here in this presentation, but if you need more resources, email us and we can get you the resources. But one of the exemptions that you can apply for, even if it's determined that you must do advancing care information, is lack of control over availability of your certified EHR technology. We understand that the radiologist practice probably does not own or determine how much the hospital may invest in their IT or even with software upgrades. So there are exemptions available. This category, because we're running a little short on time, we want to save a lot of time for questions. This has a base score and a performance score, and most of it will be attestation, a yes or no, or the QCDR will be able to collect your numerator and denominator responses. There are certain measures under each of these categories, and we can give you more details later as we build out the functionality, but want you to know that it's available. It will be available. It is important that if you do have certified EHR technology, do consider participating in this advancing care information. There is a 5% bonus, I believe. If you do, there are bonus scores available for this category. So please keep that in mind. And know that even if you are exempt from advancing care information for 2017, there may be in 2018 or future years where you would be required to get that certified EHR technology. I think it's important to transition. We talked about kind of what the MIPS categories are, what the QCDR is, and how the ACR existing registries help support MIPS participation. It's important to look at the high-level process. So if you are interested in using the QCDR, remember we said it's very important that you consider which registries you want to participate in. That's available under our NRDR umbrella. The first step would be to view all your measures and activities and improvement activities and select the appropriate registries, right? With any registry account, if you're new to NRDR, you will want part of the account setup aside from fees and who your physicians are, is selecting which registries you plan to participate in. Step 2 and Step 3, we do need to know who your physicians are. If your physicians are retiring, if they are coming to your practice for some or part of the year, we need to know that information. So we collect that electronically. And also, because this is a CMS quality program, we do need your tax ID information because that's the number you use to bill your Medicare Part B services. So we need a way to collect that information. And especially if you are doing G-Pro, remember your group is going to be assessed across all 4 performance categories, and you're going to get 1 score and 1 payment adjustment. So we will analyze your data that you submit to the registry slightly different. So go ahead and let us know that early on. And there is no requirement to pre-register with CMS. So you have all of this year to determine if you want to do group reporting or individual reporting. And then the last step is Step 4, which is not really the last step, but the last step for this high-level process is start submitting your measure data. We have the 2017 MIPS measures, and we also have the non-MIPS measures that will be released within a few weeks. So go ahead and see which of those 50-plus measures can help you report the 6 quality measures that are required for MIPS. Because this is a high level, this is a short webinar. We do have a QCDR participation checklist that is available on our website. This checklist is designed to cover every aspect of the process from registration through data submission and, most importantly, actually reviewing your information and using the feedback that we provide. So the first part of the checklist is for first-time QCDR users. You're going to look at the MIPS requirements. You're going to get set up with your NRDR account. And then with all accounts, we ask that you have a signed or completed participation agreement. If you are a returning QCDR user and you participated in PQRS, you can skip all of the Part A of the checklist and you can move straight to Part B because that's going to be, 1, refreshing yourself with the reporting requirements, which you did last year has changed, and we want you to be aware of those changes. And then we want you to start using the portal, submitting your data, submitting the appropriate codes, etc. Web link is here for the participation checklist, and everything is also on our QCDR website. So how to submit data? We talked about, the high-level process, the different performance categories, the participation checklist to help you pull it all together. But we have 6 different registries. In each of our registries, there is a different process if you're submitting a MIPS measure or a non-MIPS measure. We can collect data in a number of ways. So most of our QCDR participants, they submit data for both MIPS and non-MIPS measures to meet the participation requirements, and then we also collect the attestation for the improvement activities and advancing care information. We collect measure data through manual web-based entry, flat file or Excel file upload for my QCDR participants. Last year, you understand the importance of submitting those data files. We actually validate them within 1 day, and you have meaningful data to know if there are any errors, and you can go ahead and correct easily. We also have web services API. For 2016, we had agreements with Nuance and MagView. They were certified software partners or registry vendors that were helping radiology clients submit their MIPS measures to us directly. And also, there are web services available for the other, all of the NRDR registries.
Actually, we have a number of vendors that are using web services for PQRS.
Okay. And then for MIPS, those people should also offer those services. So for anyone on the line here, if you're working with Metainformatics or you're working with Nuance or whoever your vendor is, reach out to them to see if they have the capability to help you submit your MIPS measures. I know most people were signed up with their registry vendor, but they didn't hold them to actually submitting their files, and we want you to do that if you've taken the time and made the investment to get help with that. And then lastly, the HL7 messaging is a new data submission method that we're using for the new registry, the Interventional Radiology Registry, that makes use of HL7 messaging, which is standard language, and also use of structured report templates. So we don't want anyone, in essence, we don't want anyone thinking that you have to manually enter any information into our system. Please do abstract it from your RIS, from your PAC system, and we can work with you on formatting and getting it into the QCDR. And lastly, on this slide, there is a resource. We have an entire database table that breaks down each registry and what all the files are that are required, as well as any resources or where you need to upload to get help. So please be mindful of all resources that are provided in today's presentation. So it's important. It's very good to, this is good content, and some of you may have information overload, especially if this is your first time considering registry reporting. But in essence, our goal is, as a QCDR, we're going to work with your group, your physicians, your administrators, whoever is managing your registry process. We'll work with you throughout the year so that we can get the data that's required and we can give you meaningful feedback. Part of how we give you that meaningful feedback is through reports, and we'll cover that a little bit later, but we have an entire portal or dashboard where we're expecting the portal to be designed to help you manage all aspects of the MIPS process. So your quality measures, your improvement activities, all of your non-PQRS measures, non-MIPS measures, still have PQRS in my mind. And then some of the key features of the portal, and this, you cannot have access to the portal unless you're signed up for NearDear, so it's very important that if you are doing the QCDR, you get to see more enhanced features if you're actually signed up. But that's the location where we upload your MIPS files. You can review your quality measure performance scores. You can also see benchmarks against other QCDR participants, and you can review the accuracy of the volume that's coming in. We understand with any data submission, there's inevitable IT problems, or we may be getting a certain number of exams, and that count does not look accurate to you. So we will want you to help us to verify the data that is being sent to the ACR on an ongoing basis. And then most importantly, you have the opportunity, as Judy mentioned, you can select your measures, view performance reports, and measure scores and performance data prior to your CMS submission. So that's very important. It's an ongoing process, and you are an owner of your data, and you decide what you would like to report. And then lastly, in the portal, because our radiologists read for multiple facilities, so some facilities will have, you guys are sharing physicians, you will have multiple locations, multiple tax ID numbers. Our portal, our QCDR, has the ability to link all of that information together. What time just doing a time check. So for our as I mentioned, we mentioned it throughout the QCDR, we give you ongoing feedback. We issue quarterly feedback reports so that these come specifically from the registries, and it allows you to compare reports quarterly at the facility level or the physician level. So that's very important. The importance of the reports is, of course, to check your performance scores for improvement and analyze data submission for completeness and accuracy. Individual physician level reports are available, and we do expect your physicians to have access to their data and be viewing it. And then your physicians can review measures and authorize ACR to submit your data to CMS. I put this in most of the webinars because it's very important that without data, we cannot give you meaningful feedback reports. So here is the schedule for our 4-quarter cycle. Right now, it's April, so we're soon in May, we're going to be releasing the Q1 feedback reports, and that's for data collected from January through March. Most of you, if you are not signed up for the QCDR, you're not signed up for NearDear, you will not have access to a Q1 feedback report. But our hope is that as you make it throughout the year, through this cycle, you make the decision to use a QCDR, you are aware of these data collection periods as well as when the reports will be issued. So Q2 reports will be issued in August, Q3 reports will be issued in November, and Q4 reports are issued in February, and there are subsequent emails, communication, data quality checks prior to these release dates. Want to give a sense of an overview of the MIPS QCDR timeline. As I mentioned, this is a year-long process. Today is our first webinar for the 2017 MIPS reporting, but we will plan to offer these at least monthly. So please, if you missed today's session or you think other people from your team should join these listening sessions, please do engage them throughout the process. In general, October 31 is our cutoff of if you want to use the QCDR for MIPS reporting. Remember, that's one of your data submission options, so no one by any means is required to. We ask that you have some data submitted to the registry by that date. We'll skip on over to January 31st of 2018. That's when we need all data finalized in our QCDR. From our prior year QCDR participants, we know that December and January is a very peak time where you're checking rates, you're selecting measures, unselecting measures, adding physicians, changing physicians. That's a peak time, and we ask that you work towards that January 31st deadline, understanding that MIPS is looking at everything from January 1st through December 31st. So it's very important to not leave all of your quality data to the end of the year because you'll be very stressed out. And then going to March 1st is a deadline where we do have fees associated with using the QCDR. It's a slight MIPS reporting fee. And then, as I mentioned, the QCDR, our goal is to collect all your data, analyze it, get it ready for submission to CMS, and that deadline is March 31st. That March 31st is the exact last day that ACR or any other QCDR vendor can submit data to CMS for you for MIPS. For more details and a more extensive timeline, we do have it available on our QCDR website. This is just information about the fees because everyone wants to know how much does this cost if it's your first time participating in registries. If you start with the NRDR process, there are registration fees associated. And then for 2017, I'm highlighting this slide because we did have a slight increase in the non-member fee for MIPS participation. It is going to be $12.99 per physician per year. If you are interested in doing MIPS reporting and you have, they are not ACR members. So there is a member benefit of $199. And then if you are doing group reporting, these individual physician fees still do apply. Lastly, these are just a list of websites and resources. CMS has a great quality payment program website that lists out all of the MIPS requirements. We here at the ACR, we have developed macro resources for you. So here's the web link for that. The QCDR, the NRDR process, the checklist, et cetera, all of that is here for you so that you may reference it at a later time. And then, so next steps and considerations for using the QCDR, consider reporting as an individual or group. Remember, group practice reporters are not required to pre-register with CMS, but you do need to let ACR know if you want to use the QCDR. Consider your measures and activities. View requirements for all 4 performance categories. Understand the data submission requirements to comply, because we do have 6 registries and each of them do operate a little bit independent, differently than the other. And then assess your ability to use the QCDR for MIPS. This is not by any means a sales pitch. This is one of your reporting mechanisms that you can use for MIPS. Claims is still an option. A qualified registry is an alternative, and then the ACR QCDR is the essence of this entire talk. So just saving the dates, we do have some upcoming events. Judy and I will be at the RBMA conference in a few days in Chicago. If you're planning to be there, stop by our booth and visit us. We have the ACR's annual meeting, and it's in Washington, D.C., the week of May 21st and 25th. There are some great sessions on macro and registry reporting and everything else to help you enhance the value of care that you provide in your practice. And then we will plan to have these webinars at least monthly. We'll be posting a schedule as they become available, and we'll invite you all to participate. If you are able to, please invite your administrators, your physicians. This is an iterative process. Your IT support, invite as many people as possible to help you get through this process. And then lastly, the ACR hosts an annual quality and safety conference in Boston every year. The conference registration is open and will be in October. So I think that's the end of today's session. I see the staff here are typing furiously to answer your questions. We have a few minutes. If we don't get to all your questions, here's our contact information. You can email us or phone our hotline. And staff will answer accordingly. We have about 10 minutes for questions. Are there any general questions that have come up that we should answer vocally? And then are there any hands raised?
I could start with some of the raised hands. The first one we have here looks like it's from Lisa Fawcett. Are you still there, Lisa? Do you still have a question? I'm going to unmute you in just a second. Hey, Lisa, are you there?
I'm here.
Hey, do you still have a question for us?
No, I don't right now.
All right.
Okay, thanks, Lisa. Thanks for joining us. We recognize your name from last year.
We've also got one from Manjil Chatterjee. If you still have a question, I'm going to unmute you now. Just a second. Oh, it looks like you're self-muted, so I can't unmute you. But if you still have a question, just keep your hand up. The next one we have is Lori Ganal. Lori, your line's unmuted. Can you hear us? All right, maybe not.
And just as a reminder for anyone who participated in today's presentation, we will make available the slides as well as a recording of today's webinar. All of our sessions are recorded.
We've also got a hand up from Abid Sattar. I'm going to unmute you now. Are you there?
Yeah, I think she just answered. She's going to make the slides available. Is there a link you can provide, maybe, or to the specific location where you're going to upload the file?
Yeah, just on the QCDR website, the slides and the recording will be posted.
Yeah, we'll also send an email out to everybody that attended, and we'll have a link to the recording and to the slides.
Excellent.
Thank you.
So I'm just showing the website now. There is an entire webinars and presentation section, and here is where we would post that information.
So I think we can start now with some of the questions we've got in the question box. Judy, is there one you'd like to start with? I don't know if you were mid typing.
Okay, here's one from Narayan. I'm going to butcher your name. Narayan Biswadan. Does it make sense to enroll in as many of the non-MIPS registries that we are involved in, i.e. NMD, IR, lung cancer, GRID, and choose the ones we did well on at the end of the year? Yes, that does make sense to open up the opportunity to report as many measures as you can. One, to, like you say, have a choice at the end of the year looking at the performance scores. But if you can submit more than 6 measures to CMS, CMS will use the top 6 scores, but if the additional measures that you submitted are outcome or high priority, you can still get bonus points for those measures. So that's another reason to submit or to participate in more registries than necessary, keeping in mind the burden of doing that.
Should I start at the top with a question from Julie here?
The ones I've already answered?
The ones I see don't look like they've been answered.
Oh, sure.
So we've got a question from Julie. The question is there a plan for registry aggregate reports to be more frequent to allow for provider flexibility to adapt process to improve the data?
Well, I did answer that.
Oh, okay. It's not showing its answer. Sorry.
But I can answer it again. Let me see what it says. So the near-dear, the actual registry feedback report, so the NMD report, or the DIR report, or GRID, lung cancer screening, those are quarterly reports that every participant gets, regardless of whether they're using the QCDR or not. And for, so 2 responses to that. The data in the MIPS portal, the performance portal, will be updated on an ongoing basis throughout the year. So you could see updates and more live sort of data there based on what you've submitted. But to keep in mind that the near-dear feedback reports are facility accounts. So if you have multiple hospitals, facilities that have an account, say, for example, in the dose registry, they would receive a report for each of the facilities, and that's not aggregating the data at your 10 level or your group level. And that's what you would find in the performance portal. There is a QCDR preview report for all the registry reports, but again, that is at the facility level. And we're also working on live reports, live in quotes reports, for all the registries, for all near-dear participants, similar to the Excel reports that we have available now for DIR. So we're working on the ability for the users to play around and look at their own data at any time. That wouldn't provide as much comparison data, but you would be able to see your data.
Thank you. We have time for a few more if they're in.
Okay, we've got a hand raised from Michael Bowl. Michael, I'm about to unmute you.
Hi, Mike.
Hey, are you there, Mike? If you're not, I see the question that you typed to us, so I could just read that. All right. So Michael's question was, if some of my radiologists are determined to be patient-facing and I am in a GPRO, will the entire group be subject to the patient-facing requirements?
So it's not necessarily. It's based on percentage of your individuals in your group that are considered patient-facing, and I think it's 75%, or it might be greater than 75%.
75%.
75%
of them have to be non-patients.
So if 75% of the individuals in your group are considered non-patient facing, then your group is non-patient facing if you're reporting as a GPRO. Okay.
Looks like that was all the hands. We do still have some questions here. We've got more questions than we have time to answer, so I don't know if we want to pick out a few super good questions.
or not ones that are really hard.
Yeah, easy ones.
Sorry, but we will get to these questions. We'll answer them all if we can't do it now, but later. Benchmarks. For non-PQRS measures, we are not seeing these for lung rads or GRID. Are there plans to include benchmarks? I'm not sure if you mean CMS benchmarks or the registry benchmarks. And many of the QCDR measures, our QCDR measures, don't have CMS historical benchmarks. But what CMS has said is if a measure doesn't have a historical benchmark, they will try to use the same year benchmark, which you wouldn't really know until the end of the year, which isn't that helpful. But we do provide the registry benchmarks in the performance portal, so you can at least compare to that.
We've got one here from David Monaghan. When submitting as a group, if one radiologist performs an improvement activity, can the entire group attest, even if most members did not perform the IA?
Yes, that's true.
So it would be the group attesting to the IA, not the individual.
If they're reporting as a group.
If they're reporting as a GPRO.
Right. But you could always participate in RScan, and the whole group would really be participating.
Mm-hmm.
Yes, RScan is one of those activities that we've identified on the improvement activities list. It's weighted as a high priority. If you do RScan, I think you get credit for about 7 or so activities. So you would be done if you did that.
Okay. From Denise Lucarelli. We have a separate 10 for MRI exams. What if there are not enough measures available for MRI exams? This year is transitional. What about 2018? And that historically has been a problem for MRI only 10s because there just hasn't been that many measures available, although that is increasing, and there are, I'd have to go back and count, but I think there's at least 4 MIPS measures that have MRI in the denominator, maybe more. And there are, there's only really one in our DR measure list, the grid MRI report turnaround time. So yes, in 2017, you could still avoid penalty and potentially get a positive adjustment if you report less than the 6 measures.
I think we are out of time for additional questions. We do have a process where if you have submitted a question, we have not given you a response, we will follow up via email with the person that submitted the question. Again, thank you for those who've taken time to join us on today's first educational session. We will plan to do these at least monthly. And at any time, if you have questions with the process, we have staff just email us or contact us via phone, and someone will be able to help you with account setup, measures, the portal, etc. And then do be mindful that we are enhancing our existing portal because to make that transition from PQRS to MIPS. But please do stay tuned for future webinars. Thanks. Have a good day.
Thank you.